Hi, I'm Dr. Jessie at the Healing Collective in Niwot, Colorado, and this video covers learning how to improve motor control of your tongue and the front of the throat in order to promote healthy cervical spine or neck alignment and support. So oftentimes, this is the missing link for people who are doing their PT exercise, doing their chin tucks, doing their postural work, doing their strengthening, releasing scar tissue, etc. But still, there's a challenge with controlling the, pain in the neck. And usually it's because we've focused so much on the back of the neck, which is important. The little interspinal muscles and little suboccipital muscles, those are all essential to gain some control and some support, but we're missing half of the neck when we're not addressing the front of the system. So this video is going to cover some first steps on initiating your ability to support your neck, give yourself this whole new level of cervical spine support by addressing the throat, the neck, in the front, and also the tongue position. I hope this is helpful to you. So the first step is knowing what the problem is. So I'll demonstrate because I have worked on this in my own system quite a bit. So I have a very great example of what is not optimal and then toward what is optimal. So most of us spend our days with rounded shoulders, forward heads, looking at our phones, typing on the computer, driving, being at a desk. We have such a sedentary lifestyle that it's totally impacting our structure, which then impacts our function. So the first step is important. So getting out of that rounded, hunched forward position, stacking your shoulders over your hips, and then drawing your ears in line with the center of your shoulders. So that's a great first step, and most conventional PT will get you there. The next step, though, that a lot of standard PT isn't quite on board with just yet, is this control of the throat and the neck muscles. So once we're in more of an optimal posture, and again, ears over shoulders, over midline of shoulders is optimal, then we can observe what's going on in the throat, right? So here, if I just kind of rest here, I've got this sort of saggy, lazy tissues and structures in the front of the throat here. What is optimal is when you have the skill of lifting the bottom of the throat, okay? Lifting the tongue to lift the throat. And all of a sudden I get a cheekbone, I get some muscular support. You have this muscular hammock at the throat that when you lift and you draw the tongue toward the roof of the mouth, inverts and pushes up. So instead of the sagging sort of, one of my patients calls it a turkey neck or a gobbler neck, right? That's just kind of not very useful. You're gaining the muscular support of that structure. It takes practice, and many of us have a hard time finding this at first, so it takes repetition and practice. But here again is an example of not optimal and then more optimal. So the first step to finding this action in the front of the throat, this inversion of the hammock, you can pretend like you are sucking on a sucker, not a round sucker, but a flat sucker. So then placing that imaginary sucker to the roof of the mouth, and then very gently, it's not like a huge suction effort, it's just a gentle effort, helps the entire tongue to draw up into the roof of the mouth. And you can feel it happening, and you can look at it for it in a mirror. So when I have people find this exercise, practicing it many times a day helps it become more automatic. At first, we have to use our conscious awareness to evoke this action, and eventually it becomes more and more natural. So some people like to set a timer on their phone for once an hour just to ding and go, oh yeah, I need to do this. And then you can go about your day doing your computer work, doing any of the work that you're doing, but keep maintaining that lift. You'll notice that the tongue position is such that almost the entire tongue is flattened toward the roof of the mouth, or not flattened, but lifted toward the roof of the mouth. So the tongue action mirrors the base of the throat action, and that is a really helpful way of kind of thinking about this first step. So when you lift, see if you can hold at first for 10 seconds. And then as that becomes easier and easier, then you can hold it for longer and longer and longer, holding it for minutes and minutes at a time eventually. But start gently and work your way up slowly. The next step, after you've practiced that sucker technique or suction technique of drawing the tongue all the way to the roof of the mouth, you might try finding that same action of the tongue lifting, but without the suction. See if you can get a sense for lifting your own tongue, but without using that suction mechanism. It almost feels like initiating a swallow, but not following through with swallowing, right? So it's just a gentle lift, and it feels very, in my system, it feels very posterior toward the back of the throat, and it feels like a lift of the tongue, and then the rest of the tongue follows and just kind of rests along the roof of the mouth. So that's just a progression of the suction exercise into seeing if you can find it just with your own muscular action rather than using that suction mechanism. There's nothing wrong with the suction mechanism. It's just good to have multiple options, multiple ways of accessing this movement. Both are going to give you some support of your cranium over your rest of your system. Both will give your neck support. So they're both very useful and helpful to practice. And the last little piece of information that I like to offer in this video is the natural resting position of your tongue. If you are at rest, not thinking about it, which might be a challenge now because you're really thinking about, wow, where's my tongue in my mouth? But if you're just going about your day and think, okay, where is my tongue resting? If I'm not talking or eating, the tongue should ultimately and ideally be resting with the tip of the tongue at the rugae, which are the ridges at the roof of the mouth behind the front teeth. So here's the roof of the mouth. Let's say these are the front teeth. And then there are these ridges just inside where the tip of the tongue should be resting right on those ridges. So check in with yourself. And if the tongue is not resting there, if it's resting at the base of the mouth, or if you open your mouth and stick your tongue out, or just look in and you have tooth marks in the sides of your tongue, that can indicate that your cranial vault isn't wide enough for your tongue, or that you just don't have optimal resting position of your tongue. The implications of correct tongue position and correct craniofacial structure are huge. Sleep apnea, asthma, breathing problems, forward head posture, neck pain, postural issues, the list goes on. So optimizing the resting position of your tongue so that it's at the roof of the mouth can be very useful. So if your resting position is not at the roof, with the tongue at the roof of the mouth, check in with yourself. Can you find that position? Is it possible for you to get the tip of your tongue at the rugae, the ridges, just behind the front teeth? They shouldn't be touching the teeth, just behind them or back from the front teeth. And if not, can you press your tip of your tongue into the ridges of the mouth? And then can you find that action of pressing the tongue into the rugae, the tip of the tongue into the rugae, and then at the same time as you're pressing the tip of the tongue into the ridges, can you lift the muscles of your throat? So here's a demonstration. And can you hold that? And how long can you hold that for? Ideally, that should be your resting position. It shouldn't be effortful. It should be something that happens naturally. Now, it's so common for us not to be in that position because of our culture, because of the way we spend our time. Most of our day seated, most of our day at a computer, or laying on the couch, or whatever we're doing is not what our ancestors did that helped promote optimal posture and optimal craniofacial features. So if you are very regular with this practice and really commit to finding that additional anterior or front of the neck support, this can very well change your experience with posture, with neck pain, and with many other conditions related to craniofacial features. So thanks for your attention. And just one additional note, if you have a history of a motor vehicle accident, of head trauma, of vagus nerve dysfunction, you may need additional support beyond just the exercises in this video to really help you optimize your posture and your ability to access what we're trying to get you to do with these exercises. It may benefit you to see a manual therapist or a frequency-specific microcurrent practitioner in order to help mobilize the structures in the front of the neck, the vagus nerve, release adhesions, optimize your ability to access your nervous system so that you can find these movements. Sometimes with chronic inflammation and with any injury where the body has to repair a tissue that's impacted by a whiplash injury or otherwise, the body lays down scar tissue in order to heal. And sometimes as we do that, tissues get adhered to each other as the scarring gets laid down. So doing some manual therapy, some frequency medicine work can help with your mobility and ability to actually be able to access your nervous system so that you can do these activities. So if you're trying this video and you're like, wow, I just can't find the lift of the throat, or I just can't get into a neutral position without it feeling like so much effort, your body should be able to rest in a neutral position without it feeling like you have to hold it there. If you feel like you have to hold it there, you have to crank your shoulders back, or you have to really draw your neck back, there might be some adhesions or scarring or just tension that could use the benefit of some prescribed exercise or hands-on therapy or frequency work that might help you. And that's what I'm here for in Niwot, Colorado. So if that's something that you would benefit from, please feel free to reach out. You can call our office and schedule a free 15-minute consultation with me, Dr. Jessie, at any time. Thanks for your attention. Be well.